Okay, so this is a tutorial on the general skeleton. I won't be going into a lot of detail about each individual bone and all their features. If you want to learn a bit more about that, then have a look at some of my other tutorials. So the skeleton has both fused and individual bones, and it acts basically as a framework for muscles to attach to, and it also protects and supports organs such as the heart, lungs, and brain. Bones are connected at joints by ligaments, which on this model here are these little white things, and muscles are attached to bones by tendons. And you've also got cartilage, which can be found between various joints. So the skeleton can be thought of as, well, it's broken into an axial and appendicular skeleton. So the axial skeleton consists of the bones along the central axis of the human body. So there are 6 bones which make up the, well, not 6 bones, 6 things that you need to remember that make up the axial skeleton. So you've got the skull, the ossicles, which are little bones in the middle ear, the hyoid bone, the rib cage, the sternum, and the vertebral column. So I'll just quickly show you those. So these bones make up the axial skeleton, which is the central axis of the human skeleton. So the first bone is the skull, which you probably don't need to be told. The ossicles actually aren't on this model, but they're little tiny bones in the middle ear. This bone in the throat is the hyoid bone. So click that there. Then the sternum here, and the rib cage, which is the set of ribs, and then the vertebral column. So that's the axial skeleton, and as you can see, it's central. The appendicular skeleton, as you can probably guess, comes from the word appendage, so that basically means something that's attached onto something else. So it's essentially all the rest of the bones that aren't in the axial skeleton. So all your limbs, and the appendicular skeleton is involved with movement. So you've got the appendicular skeleton and the axial skeleton. So when you come across those words, you'll hopefully know what they mean. So just to begin with, we'll start going through the bones of the body. I'll start at the top and work my way down. So we've got the skull here, and the skull consists of the cranium, which is this, and that in itself consists of many different bones, but we'll look at those in another tutorial. And then you've got the mandible. So the skull consists of the cranium and the mandible. So next you've got the vertebral column, which extends right from the base of the skull here all the way down to meet the pelvis. So in the vertebral column you've got 24 articulating vertebrae, which is these little bones, individual bones. And then at the end of all of them you've got the sacrum and you've got the coccyx. And the sacrum and the coccyx consist of fused bones. So within the vertebrae you've got the first 7 vertebrae are the cervical vertebra, and then you've got the next 12 which are in the chest region, and these vertebrae articulate with the ribs. These are known as the thoracic vertebra. And then you've got the lumbar vertebra, 5 lumbar vertebra in the lower back region. So you've got 7 cervical, 12 thoracic, and 5 lumbar vertebra. So I've already shown you the hyoid bone here, and spoken about the ossicles. The next part of the axial skeleton is the sternum. So this central bone here, otherwise known as the breastbone. So there's three parts to the sternum. It doesn't have them labelled, but the first part here is the manubrium, and then you've got the body of the sternum here, and then this is the xiphoid process, or the xiphisternum. So that's the breastbone, and this little joint here between the manubrium and the body of the sternum is known as the angle of Louis, or the sternal angle. And it's quite important to know this. It's an important anatomical landmark, because this is where the second rib joins. So when you're doing physical examinations on patients or something, you can use this landmark because you know it's the second rib. And so if you're looking for the apex beat, for instance, which you know is in the fifth intercostal space, mid-clavicular line, you can feel for this little angle here, the angle of Louis, and then it's 3 intercostal spaces down, and then in the mid-clavicular line, bring in the heart. So you know that this is this second intercostal space because it's after the angle of Louis, and then you just count down to the fifth intercostal space, and you can find what you're looking for. So that's that. That's the sternum, and then you've got the ribs here, which is part of the axial skeleton. So you have got 12 pairs of ribs, so 24 ribs. You've got, and then these 12 ribs get broken down into true and false ribs. So you've got 7 true ribs and 5 false ribs. So these things here are the costal cartilages, and they link the ribs to the sternum. So the true ribs, the first 7 ribs, are the ribs which have their own costal cartilage. So 1, 2, 3, 4, 5, 6, 7. So they've got their own costal cartilages. And then you've got 5 false ribs. So these next 3 ribs have a common costal cartilage. They don't have their own one, so they're false ribs. And then you've got these two little ribs below that, the 11th and 12th ribs, which are known as floating ribs, because they don't even have a costal cartilage. They don't connect to the sternum. They only attach to the vertebra. So you've got 12 pairs of ribs, and of those 12 pairs you've got 7 true ribs, 5 false ribs, and of those 5 ribs you've got 2 floating ribs. So that's the axial skeleton that I've just covered. Now I'll just talk a bit about the appendicular skeleton and show you the bones of that. So just starting from the top, we've got these 2 bones here, which are the clavicles, or you may know them as the collarbones. And you can see these on yourself, and you can feel them on yourself. So if I just show you that, you can see that little indentation, which is the clavicle, where the clavicle lies. And then you've got your upper limbs, so you've got your upper arm, your forearm, and then your hand. So the bones of the upper arm are known as the humerus. So this bone here is the humerus. And in the lower arm you've got the radius and ulna. So the ulna is the bone which is medial in the anatomical position. The radius is lateral in the anatomical position. So these are the 2 bones of the lower arm. And then in the hand you've got quite a lot of bones. You've got the carpals. You've got 8 carpal bones, which I'll do a separate tutorial on. You've got the metacarpals, and you've got the phalanges, which are the fingers, the digits. So if I just show you that, you can see that you've got 3 phalanges, the metacarpals, carpal bones. So that's the bones of the upper limb. And if I just rotate this around, you can see this bone here, which is the scapula, and this articulates with the humerus. And this is, you'll be able to feel this on yourself again. It's often referred to as the shoulder blade. So that's the scapula. Okay, so working our way down. So now we've got the pelvis here, and the pelvis consists of the pelvic girdle, which is these big two hip bones, and then you've got the pelvic region of the spine, so the sacrum and the coccyx. So that's the pelvis. So these pelvic bones are known as the coxa, and they consist of three fused bones. You've got the ilium, the ischium, and the pubis. So each hip bone or coxa consists of three fused bones: ilium, ischium, and pubis. So that's the pelvis. And then coming down to the lower limbs, you've got the leg, you've got the thigh, the lower leg, and the foot. So this big bone here is known as the femur, and it's the largest bone in the body. And in the lower leg you've got the tibia and the fibula. And the fibula is lateral, and you can feel this little bit here, the head of the fibula, on yourself. So it's that little bump on the outside of your leg, just next to your knee. Have a look there. You can see where it lies. Just here. So you've got the tibia and fibula, and then in the foot you've got the like in the hand you've got carpal bones. In the foot you've got tarsals. So in the foot you've got 7 tarsal bones. Again, I'll cover these in more detail in another tutorial. Then you've got the metacarpals and the phalanges, which are your toes. So you can see that. And then you've got the patella, which is your kneecap here. So I think that covers the general skeleton. I hope you've got a good understanding of it now. If you want more detailed tutorials on the individual bones and the different features, then I'll be doing a few soon. So check back and have a look out for those.